Good morning to all. The title of my paper is Ocular Examination of Seropositive Children, Deadly Disease but Preventable Neglect. Acquired immunodeficiency disorder caused by human immunodeficiency virus emerged in 1981 and has presented with ocular manifestations like molluscum contagiosum, herpes zoster, CMV retinitis, and many others. Vision-threatening ocular manifestations are often the earliest presentation in HIV-affected children. There are 21.40 lakh people living with HIV in India, out of which 0.06 lakh are children, and Maharashtra has the highest PL-HIV in India. In our study, we took 31 children belonging to an orphanage for the HIV positive into a non-comparative, descriptive, cross-sectional, single institution study. After the consent was taken from the guardian of the orphanage, ethical approval was taken from the ethics committee of the institute. Duration was between April to May 2019. All the HIV positive were included except those who were not in a general condition to undergo any examination. The first set of examination was done at the orphanage itself that included recording of the age, sex, duration, mode of transmission, history of treatment, other systemic illness, most recent CD4 count that is done on a 6-monthly basis by the orphanage itself. The ocular complaints, the torture examination, head posture, facial symmetry, ocular movements, visual axis, and pupillary reflexes. The second set of examination was done by the hospital, but done at the hospital by bringing the children in batches that included distant visual acuity on Snell's chart, near visual acuity on Jaeger's chart, anterior and posterior evaluation by slit lamp, fundus evaluation by indirect and direct ophthalmoscopy after dilating with homotropin. Fundus photograph was taken for significant findings on fundus camera, and retinoscopy was done in all. Results: 31 children with a mean age of 13.25 plus minus 3.9 years were ranged between 6 to 18 years. Maximum patient belonged to the age group of 15 to 18 years of age group. All were on ART treatment. Pulmonary TB was present in 2, and 1 was a suspected case of systemic lupus erythematosus. As you can see, male is to female ratio was 20:11. Now, mode of transmission was 94% were vertical transmission, the rest 6% was not known. Duration of HIV was present since birth in 52% and rest 48%. Mean age of diagnosis was 8.9 years. Now, 16 children were diagnosed to have refractive errors, that is 51.6%, out of which myopia was very common. Refractive error correction was given in all and improved to 6/6, except 1 who had optic disc coloboma. Now, 35%, that is 11 out of 31 children had ocular involvement. Anterior segment prevalence was 29%. Lesion prevalence, out of which corneal opacity was the most common, followed by vernal keratoconjunctivitis. The other findings like meibomitis, blepharitis, peripheral cortical cataract, episcleritis, and anterior uveitis was also present. Posterior segment lesion prevalence came out to be 12.9%. Healed choroiditis scars were 2, and 2 colobomas, 1 chorioretinal coloboma and 1 optic disc coloboma. Now you can see anterior segment findings were more common in CD4 count less than 200, but significant association could not be found. Let's go to the discussion part. Now, compared to the other study, the prevalence of ocular lesion overall ranged from 21 to 50%. Ours was well within the range with 35.4%. Anterior segment lesion prevalence ranged from 7.6 to 65%. Ours was again well within the range with 29%. Posterior segment lesion prevalence ranged from 25 to 84.6%. Ours was not within the range. In fact, we had a much lower prevalence of posterior segment lesions. Now let's go to the types of lesions. Mohod et al. And Venkatesh et al. got allergic conjunctivitis very commonly, followed by blepharitis and corneal opacity. Venkatesh et al. got corneal opacity as a very common finding, very much similar to ours. Biswas and Gogri et al. They got anti-uveitis as a very common finding, but we could only get one of such a case. But they had similar findings like lid infection and blepharitis. Now, international study like Acuna et al. And Padani et al. Had molluscum contagiosum as a common finding, followed by conjunctival cirrhosis, owing to the vitamin A deficiency in their children, which we did not find among our children. Now, let's go to the posterior segment. As you can see, Venkatesh et al. Had healed choroiditis scars as a common finding, which we also got, but other findings like retinal perivasculitis, CMV retinitis, HIV retinopathy, macular edema was not found in our study. Now, the reason could be due to much smaller sample size or a periodic health checkup and an improved health status among the orphanage children. Now, a case report in Nepal was the first one which stated a causal relationship between HIV and heart with occurrence of colobomas in reference to efavirenz exposure in first trimester pregnancy. Now, both children in our study with coloboma had were HIV positive since birth with HIV positive mother. We can conclude that this might be the first Indian study to show colobomas in pediatric HIV cases. I would suggest further study to be conducted over larger sample to develop a potential relationship between the two. As you can see, we got a mean CD4 count of 688, very much similar to others. Others could get a significance between low CD4 count and ocular involvement. We did not get such a significant association. I think my previous slides were well concluded. I would state the limitation with we had a smaller sample size and we did not have any control group. Thank you.